Hi everyone, I'm Dr. Akhila. Today we are going to talk about how irregular cycles can affect fertility. So before that, let's quickly understand what are regular cycles. So when a woman experiences a period uh, between 21 and 28 days, typically most women get their period within 28 days, but the range is between 21 to 28 days. So when you get a period in this time frame, that is considered to be a regular cycle. Now, what is more important than just a regular cycle is a predictable regular cycle. So, if a woman is able to predict her periods, then that most often is an indication for a cycle that is not only regular but a cycle that is ovulatory as well. Now, what does regular cycle indicate? So when a woman is having regular cycles, the body is getting prepared for ovulation and after that a pregnancy. This is the importance of a regular cycle. Now, when you have a predictable regular cycle, which means that mostly it's an ovulatory cycle and we can expect a pregnancy chance in that cycle. So this is what it means. Now, sometimes fluctuations in a cycle are very common. So we need to understand that if you're expecting a period within 28 days, if a period crosses and you get a period by 30 days, is that something irregular or is just a fluctuation? So fluctuations are quite common. That could be because of medicines, it could be because of stress, sometimes taking OC pills, IUCDs, thyroid problems. These are some of the conditions where fluctuations can happen in a menstrual cycle. So, what is otherwise normal and when can we expect these fluctuations to be abnormal? Let's understand that. So, when a period cycle duration is less than 21 days or more than 35 days, that is when we think that the cycle is irregular, or if the bleeding lasts for more than 7 days, then again that is something that is a problem. A woman can experience heavy bleeding. Normally, about 5 to 80 ml of blood loss is expected in each cycle. But what is heavy bleeding? So, when a woman is passing clots which are more than 1 inch in size or soaking a tampon or a pad every hour, these are the conditions that tell us that it's a heavy bleeding. Also, if she is experiencing pain that is excruciating in nature, which means she's unable to perform her daily activities or go for work, then these are the conditions that again tell us that it probably is not a regular cycle. Now let's understand what are the irregularities that we can expect. So one is amenorrhea, that is there is no period at all, absence of menses. The other is oligomenorrhea, that is a period coming very scanty and after a prolonged duration of more than 35 days, or heavy menstrual bleeding, which includes a period which comes less than 21 days, or there is bleeding in between the cycle, which we term as metrorrhagia. These are some of the things that tell us about irregularities in the cycles. Now, let's understand one by one. Amenorrhea, which means absence of menses, can be either primary or secondary. Primary amenorrhea means that a woman has never experienced menses at all. So, this can be because of genetic conditions, or this can be because of anatomical issues, that is, cervical stenosis or vaginal issues. It can be because of these. Now, when we have secondary amenorrhea, that means she's been having regular cycles or cycles, and now it's become uh, absent. Now, there's no period at all. So, this is secondary amenorrhea, and the causes of secondary amenorrhea again could be genetic or premature ovarian failures or early menopause. These are some of the conditions that can cause secondary amenorrhea. Importantly, we must always rule out a pregnancy when cycles become irregular, either when it is prolonged or secondary amenorrhea. Pregnancy is one thing that can cause irregular periods, so that is one condition that should always be kept in mind. Now coming to oligomenorrhea, which means the duration of the cycle is more than 35 days. Now, this can happen in conditions like PCO, polycystic ovarian syndromes, thyroid problems, or prolactin issues uh, when they're taking some medications, congenital adrenal hyperplasias, increase in androgen levels in the body. These are the conditions that can cause cycles which are lasting longer than 35 days. So, what is typically alarming is if a woman doesn't experience a period for more than 3 months, that's when it is quite alarming, and you must consult a physician. And the next condition is if the cycles are heavy, they have heavy bleeding. So these are the some of the conditions that I've already explained to you. What are the symptoms and when can we expect a period to be heavy? When do we call it? That I've already explained. So what are the conditions that can cause this? Is polyps inside the uterus, cervical erosions or cancers, or fibroids, adenomyosis, endometriosis. These are some of the conditions that can cause periods that are heavy or lasting for less than 21 days. So all these conditions can affect fertility, the ones that I have mentioned, because once the cycle is irregular, it becomes very difficult to predict when to have intercourse or whether the cycle is ovulatory or not. So then that is how pregnancy becomes a challenge in these scenarios, because the hormone fluctuations are high. The other condition is that one thing that most couples have a doubt: if the cycles are regular, does it mean that they can never get pregnant? No, the answer is not that. You can get pregnant if the cycles are irregular. It just depends on we cannot time when the intercourse can happen, or that kind of a scenario. And about irregular cycles, also it is the one thing that I wanted to mention is regular cycles doesn't essentially mean ovulatory cycles. I've already told that. So a predictable regular cycle is what tells us that it's an ovulatory cycle. And ovulatory cycles can also be regular in nature, but we don't have an egg growing in these kind of cycles. Um, I think that's all about irregular cycles and how it can affect fertility. Any questions, please? As a woman suffering from irregular periods, can I conceive without any complications? So I just mentioned that irregular cycles does not mean that you can never conceive, but it becomes very difficult to tell whether a mature egg is growing or not growing. And per se, it does not have any complications. Should a pregnancy occur because of during these irregular cycles, if it is progressing well, there are no complications that we can expect. But in women with PCO or fibroids or polyps, chances of miscarriages, uh, stillbirths, fetal growth restrictions, these are some of the conditions that we can expect. Women are more prone to gestational diabetes, hypertension in conditions in women with PCO. These are some of the things that can happen. It's very comforting that this sensible concern is being talked about openly. Thank you so much. I wanted to know about any small lifestyle changes that I can make at home to regularize my periods. So, lifestyle is the most important thing. Excess of exercise or eating disorders can also lead to irregular cycles. So, a healthy lifestyle is very important when it comes to fertility. As a matter of fact, not only fertility, for basic health as well. So, regular exercise, healthy diet, good sleep of at least about 8 hours is something that is going to take you a long way ahead. And that's about it. I've been tracking my cycle since I was 23 years old. it's always between 40 to 52 days cycles. Now I am 32. Is it possible to get pregnant without any issues? So when you have a period that is between 40 and 52 days, so it is typically irregular cycles, most likely anovulatory cycles. You can definitely get pregnant with this kind of a scenario. You would just need a little treatment for ovulation, for the egg to grow, and subsequently pregnancy can happen. I have PCOS and I was diagnosed at 16 because I had severe abdominal pain. I had my first child at 28 naturally. Now I'm 32 trying for the second baby. What should I keep an eye out for? Um, not all women with PCO essentially have irregular cycles. So, if you have conceived naturally at 28, so you can also try to conceive naturally at 32. You can give yourself about 6 months to 1 year time if everything else is okay, and if you're having regular cycles. And like I already said, healthy diet, regular exercise, good sleep. That's all I would recommend as of now. Thank you.